Hi, today in this video, I would like to talk about a very common side effects that we usually see in people who have been started on antipsychotic medication. It can also happen with a lot of other medication, even with the antidepressants also, and with some other non-psychiatric medication also. So I would like to discuss that side effect, which is very common and sometimes it's being missed or sometimes it's being diagnosed as anxiety or restlessness or exacerbation of a person's psychiatric problems. So the name of that problem is akathisia. So what akathisia is, basically a person has inner restlessness. They are restless from inside. They are pacing. When they are pacing, when they are walking, they feel a little better. It's usually started when someone is being started on, let's say, antipsychotic medication, especially older antipsychotic medications like Haldol, thorazine, perfenazine, but it can also happen in newer antipsychotic also. So even medication I have seen with medication like Abilify or Latuda. So any newer antipsychotic can cause it also. There are few antipsychotics that have less side effects, but it does not mean they don't have that side effect of akathisia. So medications like quetiapine, olanzapine, or clozapine have less of those side effects, but it can still happen. So whenever a person is being, let's say, started on antipsychotic medication, they can develop this inner restlessness. They have hard time sitting still. They are fidgety. They are pacing in the unit. And sometimes what happens, it's being diagnosed with anxiety, or a person is getting restless, or a person is having increased psychosis. Sometimes a person, due to this side effect of akathisia, can get a little agitated. So sometimes provider can feel that, hey, maybe the person's psychosis is getting worse, but it's usually the akathisia. So when can that happen? It can happen anytime, but usually sometime few hours to up to few weeks. The first 4 weeks are more important. It can happen anytime, sometime even within the next 3 months when a person is being started on antipsychotic. But mostly I have seen the first month or so. So that's why it's very important to diagnose it earlier, because if it's not been diagnosed, then medication changes happens, or more medications are being added, or the same medication that is causing the akathisia, if the provider feels the person is having anxiety or agitation, so that same medication is being increased and the akathisia get worse. So the first thing is to diagnose if it's akathisia or not. Sometimes it's being a little challenging. Sometimes a person or provider is not sure if it's anxiety or akathisia. Usually with the anxiety, usually a person will be ruminative about the anxiety. They will be worried about something. They will be talking about that thing. Anxiety is also more on the upper side, like they will have muscle tension in their body, chest pain, nausea, stomach upset. So they will be a little restless. It does not mean when they will be pacing as much, or they have hard time sitting still. So anxiety can cause it, but not as much as akathisia can cause that. So first of all, once we figure out, okay, this is akathisia, the first thing is to do is to do the protection. Protection is means I mean to say is to rule out if this is causing significant side effects like even self-harm thoughts, because it's so uncomfortable. A person is having increased restlessness and they just sometimes wants to harm themselves. And then we have to, after we protect the person, we rule out any imminent danger, then we have to figure out, to diagnose, to detect, is it akathisia or is it anxiety. The other thing that also help us to figure out is when the duration is, was a medication recently started, was the medication recently increased, did the patient got long acting injection, was there abrupt tapering down or increase of the medications have happened, and also if there is subjective increase in the anxiety of the person, or if the person had these kind of symptoms even before, because sometimes with anxiety the person have anxiety even before the medication was started, but with akathisia it's not the case. Usually it happens once you start a medication, once you increase the medications. And then once we figure out, so this is akathisia, also the staff member, let's say if you are working in inpatient unit, usually the staff will be able to let you know, a staff who's on the floor will let you know, hey, the patient was started on, let's say, Abilify or Latuda or Risperdal. Since then, we have noticed that he's getting more upset, more agitated, not sleeping well, restless. So you can get this history from the patient, from the staff, or even from the family. Family will come and visit the patient, or you will see them in outpatient clinic, and the family will say, oh, my loved one is not doing well since you start this medication. We are seeing more kind of restlessness. Also, it's not only the antipsychotic medication, even antidepressant like SSRIs, like Prozac, Paxil, Zoloft can even cause that. Even SNRIs like Effexor, Cymbalta can cause it. I have also seen in people with lithium can cause that restlessness also. And even non-psychiatric medication like anti-nausea medication can also cause that, or medication that is used for some other reasons also in the ER also that can also cause it, like metoclopramide can cause it, droperidol can also cause that. So make sure that you have a good history from the patient, reviewing the chart, talking to the staff, talking to the family. Also, find out if the patient has some labs done, because sometimes even low iron or iron deficiency can even cause some increase of akathisia, and sometimes even exacerbate if a person have restless leg syndrome, like they have some other illness called restless leg syndrome. They have hard time, uh, s- uh, they have the restlessness in their lower extremities usually. Mostly it happens in the evening or at night time, and they have the urge of moving their feet. So we will talk about restless leg syndrome in another video. So what we have to first figure out, once we figure out this is akathisia, then we have to find out how to treat it. The first thing is, if you find out it's the medication that causing it, so you have a couple of options. Either you cut down the dose of the medication to see if akathisia get better, or if you can switch it to a different medication that can stop that akathisia. Let's say if the person has side effects from risperidone and you start the risperidone at 1 milligram, so can you cut it down to 0.5 milligram? Or if the patient has been started on Abilify 5 milligram or 10 milligram, can you cut it down to 2 milligram if it's possible? In some cases it might not be possible. Let's say if the person is in acute psychiatry hospital, is pretty agitated, pretty paranoid, hearing voices, getting aggressive, so you cannot cut down the medication because you feel that if I'll cut down, even with the current dose, the patient's symptoms are still patient is still symptomatic, is still is pretty psychotic. You might have to try different antipsychotic, maybe Zyprexa or quetiapine. So you have the option, either stop that medication, try different medication, cut down the medication, or even do a drug holiday if it's possible. The other thing you can also do is to check the levels of the blood level of, let's say, iron. If the person have iron deficiency, anemia, so you can treat that also. You also have to make sure that the person's use their coping skills, anxiety skills, walking, hydrating themselves. And then the other option is to treat it with medication. There are different medications. So the main medication that I usually use is propranolol. Usually you can start at 10 milligram twice a day, or 10 milligram 3 times a day, or 20 milligram twice a day. Ideally, I recommend twice a day. If the person is inpatient, you can use it 3 times a day. But once they get out, it's better a person is on medication that they don't have to take it that frequently. So twice a day will be better. You can go up to 80 milligram even, and some people are even on a higher dose than that. But propranolol is a blood pressure medication, so make sure you check their heart rate and make sure that they don't have any dizziness when they are taking the medication. Try to avoid propranolol or beta blockers, most of the beta blockers in patients who have asthma, because it can exacerbate the asthma. The second choice is mirtazapine, which is an antidepressant. You can use it at 7.5 or 15 milligram. The advantage of using mirtazapine is it can cause sleepiness, so they can take it at night time. But if they are concerned about weight gain, because lower dose of mirtazapine can cause weight gain, so then you have to try a different medication. The other option is benzodiazepine, like clonazepam, even 0.25 twice a day or 0.5 twice a day can be helpful. But if they are older patients, if they have memory problems, they have dementia, if they are at risk of falls, or if they have substance use problem, then you will like to avoid that medication like clonazepam or even lorazepam, which is the same family. Some people use cogentin, the benztropine. Research does not show it is that much helpful. Usually it is used for people who have other symptoms like other extrapyramidal side effects, then we are usually using it, but not for akathisia. So I usually don't use it. Some people have even tried trazodone at a low dose, like 50 milligram. It can help with sleep and also can help with akathisia. Some people have even used clonidine, which is a blood pressure medication, also is used for anxiety and also for some symptoms of ADHD also. So you can try that at a very low dose, but make sure that blood pressure is being checked. Sometimes people use vitamin B6 also. That can help a little bit with the akathisia. Some people have even tried amantadine, like 100 milligram twice a day or even 100 milligram once a day. In my experience, it is still not that helpful for akathisia. It is usually helpful for other extrapyramidal side effects, but you can use it with amantadine. If I've seen in geriatric population, older population, when I've used it, it can activate them a little bit. So make sure that you keep an eye on that, and sometimes it can cause some insomnia in some people also. So these are the options you have, and but the main thing is to diagnose them, because we usually miss it in inpatient, outpatient, because sometimes we start a medication, a patient come to our clinic, let's say after 3 weeks, 4 weeks, and we continue the medication, they come back after 2 or 3 weeks after, then they start having these side effects. Sometimes we don't remember what we have done like 6 weeks ago or 8 weeks ago. So it's better to go back in your notes, talk to the patient, their family, to find out what's the duration of these symptoms, when did it start, were there any medication changes, or were there any other medications that have been tried which are not causing the akathisia. Let's say a person has been started on a other medical medications, and then they have an interaction with, let's say, a person is on risperidone. When I started the patient on risperidone, they did not have that side effect, but due to some other medication that have added, that caused that interaction, because they interact with the cytochrome P50 enzymes, and the risperidone dose went up. The risperidone went up in the system, in the body, because of the interaction of other medication with the risperidone. So it's not that I increased the risperidone, it's that the interaction caused the risperidone to went up. So also try to do the interaction check also. So yeah, so the main thing is to diagnosing the akathisia. Get history, review your notes, do the examination, make sure if it's not anxiety or restless leg syndrome. Ideally, cut down the dose or do a drug holiday if it's possible, or try a different medication. If it's not possible, then add some other medication to help with that akathisia. I hope this was helpful. Please let me know if you have any suggestions or any other videos you would like me to put on my YouTube channel. Thank you very much for watching.